I'm not the house of cards that falls down easily. Ooh, I'm strong enough to handle what you throw at me.
Welcome to Mental Health News Radio. I'm your host, Kristin Walker. Just what are we going to discuss? The intimacy that is mental health. Let's continue to make it as comfortable as discussing brain health or heart health. This show has been on the air for several years, and we have amazing co-hosts. And then we created a network of podcasters on mentalhealthnewsradionetwork.com, a place where every possible facet of mental well-being can be talked about openly. My show, after several hundred interviews, the format is this: intimate, deep, funny, touching, sometimes uncomfortable, but always vulnerable conversations with interesting people. The goal is to have you, our listening family, many of you who have become my good friends, feel as though you are listening in on private conversations. Thank you for tuning in and becoming part of this amazing journey with me, and now with our network of podcasters. Just knowing this podcast might be helping any of you realize you are not alone on this journey called being a human being makes doing this podcast worth every second.
After all, we promised we'd be cordial.
Good evening, Dr. Paul Meier.
Good evening, Kristin Walker. How are you?
I'm good. We haven't been on in a while because we've had different things come up, and but I love what you sent. We're going to do it's going to be either 10 or 15 show series together on how we can improve our personalities. And tonight we're going to talk about correcting genetic influences on our personality, but we're going to start by talking a little bit about dogs. But tell our listeners why you wanted to do this arc that we're doing here.
Yeah. Well, I thought first it would be, people are interested in our personalities and how we can change them and why we are the way we are. And so we're going to do, approximately a 12-part series on it. And then when you and I were talking to each other here right before the program started, your dog came and jumped on your lap, and dog's name is Smokey.
Yep.
And I said, you know what? That reminds me, why don't we say a little bit about how dogs inherit personality too, and because that helps people understand better how humans can. And I'm not saying that most of your personality is genetic or anything like that. For some people, it could be, but for most people, it's probably a third or less of our personality. I think there's three things that determine our personality: our genes that we inherit, and our environment that we grow up in, especially, but our environment throughout life, but especially the first 6 years, and then the choices that we make can alter our personalities. But tell me about your dog, Smokey.
Well, you asked me, what kind of personality does he have? And I said, needy. Because that's what he has. But he is a border collie Australian Shepherd. He's 3 years old, and he definitely needs to be fixed right off the gate because that'll help with the little bit of aggression that he has. Not much, but a little bit. And, he just is one of those dogs where he wants to be basically crawl inside of you. He can't get close enough to you, pawing at you and licking and all that kind of stuff. And he will.
So you're already saying that men are more aggressive than women and need to be spayed. Or not spayed, but castrated, right?
Just dogs.
And there's some truth to that. That one reason men are more aggressive is because we have testosterone.
And there is something to be said. I mean, I like border collies because that's what I had, and that was what I did therapy dog work with.
They're the smartest.
Yep.
They're the smartest of all dogs in IQ.
Yep. And Australian Shepherds are up there in the top 10 as well. So he'll be a great therapy dog. He has to be fixed in order to be one anyway. But I like. Can
I bid in again? Since I always do anyway. That's I've got an old friend who's a psychiatrist, and he says, Meyer, you've got a new personality type that's not in the books. And I said, what's that? He said, obsessive obnoxious. So let me say something real quick about dog IQ. There's certain tests that they, of course, you can't really measure, because some are really brilliant at one thing and stupid at another, but there's a couple tricks that they see how many repetitions it'll take to teach the dog that trick. And for border collies, the average was 3. They show it to them 3 times and they can do it. And for hound dogs, it was 103.
Yeah.
And so there were, and they go all the way down the line, different dog breeds and stuff. And some dogs, but even the hound dogs would be brilliant at other things.
Right.
You know what I mean? But they just aren't good at learning those tricks. And
yeah. And we've had many different kinds of dogs in the course of my lifetime. And I have seen, like, Shiba Inus are notorious for running away. They come back, but they do like to just flee. And that's what we saw with one that we had. We had a lab and she did lab stuff. And we've had German Shepherds and they did German Shepherd things. And, for me and my personality, a dog that is very, very intelligent is that will listen to commands and is bred to please is a dog that's going to work for me. And because I need a working dog, because I really enjoy the therapy dog work. So I need a dog that I can command and, and they're not necessarily aggressive with people. They love people. And this dog loves people. Plus he's got the Aussie tail that's very short. So that just disarms everybody. Oh, look at this little tail. So just right now, he, with the extra testosterone because of his appendages that will be removed not too long from now, he's a little bit aggressive, and that'll probably calm him down from wanting to crawl into my skin all the time also.
Well, just in general, dogs, you can't say, oh, like St. Bernards are used to rescue people that are stuck in the snow, and they're just extreme. They're big, but they're extremely loving and loyal and good at finding people and things like that.
Slobbery.
And so different breeds are, some breeds are just naturally good at rounding up sheep and things like that. I mean, it seems like it's almost in their nature. So there are a lot of personality traits that are found in different kinds of dogs. And people have a lot of different personality traits, but you can't generalize and say, like, pit bulls have a bad reputation for having bad tempers. And on the average, they probably do have more explosive traits than other dogs. But there's some people that have really loving, sweet pit bulls. And
my neighbor's dog is like the most docile. My little Aussie is the alpha of her, and she's a pit bull mix. So I think it's the jaw, their tight, their powerful build. And so they were bred to be these fighting dogs, but their natural personality is so sweet. It's like they were put into the fighting stuff because of the power that they have in terms of that jaw, not really based on what their personality is like, is what it seems like to me.
So we're not saying, like, everybody that's we're not being racially prejudiced here, because there's all different kinds of people in every race, but there's just a lot of people that inherit different personality traits. That's all I'm
exactly
saying.
So we have this list. We have the first one, paranoid traits, and I'll read what you sent in. Arrogant, condescending, ascribe evil motives to others, controlling, trouble delegating, critical, overly sensitive to criticism or even perceived criticism when there isn't any, always right in arguments, no intimate relationships. Paranoid traits can come from multiple sources like childhood environment, parental modeling, childhood abuse. And then you wrote, imagine a nice puppy, but kicking it across the room every day, it will get paranoid toward all people eventually. Holding grudges, since more buried anger produces more paranoia. Choices, but sometimes also genetics. Severe in psychotic, depressive reactions, manic episodes, chronic paranoid states, and schizophrenia. Genetics, a dopamine problem.
Yeah, let's mention that puppy first, since we were talking about dogs a while ago. If you had a sweet little dog, if those of you in our listening family, somebody just gave you a gift of a nice, sweet little Yorkie puppy, or something like that, and you fed your Yorkie dog or whatever the dog is, fed the dog and hugged the dog and pet the dog. But once a day you came in and just kicked it across the room.
Mm-hmm.
Well, after a while, that dog would get more and more paranoid. And in a year or two, he'd be a lot more paranoid. And if a stranger came to the door, he would assume that stranger was going to come in and kick him across the room. And so he might even, want to bite the stranger. When the stranger's reaching down to pet him and be nice, he'd be paranoid. So kids that get abused a lot, and we're going to talk about environmental factors next one, so we won't go into it now, but there's a lot of different reasons why people can have paranoid traits other than genetics. But sometimes people inherit genetic paranoid traits where they're just automatically more arrogant, condescending, assuming that, if you disagree with them, you must be evil. And even if you tell a joke, they assume you're doing it to criticize them. And so they're just overly sensitive and things like that. Now, when they get healed, when I used to do individual therapy, Kristin, I don't now, I just do medications now, but early in my psychiatric career, I did outpatient counseling, and I'd see people once a week for a year or longer. And when I got a paranoid person, I sort of dreaded it, but at the same time it was a challenge. But once we figured out that they were paranoid, and we got psych testing on them, and that showed that they were paranoid, I would sit down and negotiate a verbal contract with them. And I'd say, I want you to promise that you're going to come see me every week for the next year. I said, there's going to be times that you hate to come see me, because, if I'm digging and probing and telling you things you don't want to hear, you may even, hate my guts sometimes. And there's going to be times when I'm going to look down at my schedule and see you on my schedule and think, oh no, not him again, or her again.
Right.
And I say, but we have to make a commitment that we're going to work through those times. And so if the person is, then, and that's true. My job as a therapist is I just keep showing love, speaking the truth in love. And when they come out with their jabs and condescension and all that stuff, speaking the truth in love. And usually after about 9 months, the love wins out and they start changing. But some people inherit paranoid traits.
I definitely did. I definitely did, for sure.
What?
Paranoid traits? Oh yeah, absolutely. I don't have that now.
I've never seen any in you.
Yeah, well, I don't have it now. I mean, I did a lot of therapy, but
but do you think they were inherited, or do you think they were the result of abuse from?
I think
childhood?
both. I think both. And since my parents were also severely abused, I mean, it just that plus genetic traits. I mean. Definitely. I remember when I was pregnant, and this was a hormonal thing, obviously. But I remember just thinking everybody was out to get me. It was horrible while I was pregnant. It was absolutely epic and awful. And then it went away about maybe 6 months after my son was born. So, hormonal changes really pushed me into some not great paranoid traits, for sure.
Mm-hmm. Yeah, hormones can mess us up. Thyroid hormone getting off can make you more paranoid or even delusional. Yeah. Steroids can make you that way. But we had a case one time where a pastor and his wife came from marital counseling because she had all these paranoid traits. And so we assume usually they're from choices in childhood and all that stuff. But she had a very nice, loving childhood. And when we looked at everything, without going into much detail, I really felt like hers, a lot of it was just genetic. That most of her siblings weren't that way, but she had an aunt that way and had an uncle on the other side of the family that way, and her dad was a little bit that way, and so I told her, I said, do you mind? I'm thinking that some of the problems that you have might be genetic, and if they are, then paranoid traits are a dopamine problem. So if I can give you a little bit of a dopamine medicine, if you don't have genetic paranoid traits, it's not going to make any difference. But if you do, it'll make a difference. And so she was willing to try it surprisingly. And it only takes about a week.
Right.
Dopamine, like Seroquel or Abilify or any of those are dopamine.
What about Prestique?
And
Okay.
no, Prestique's the serotonin does it. That
Okay.
wouldn't do it.
Wellbutrin would
so,
be the dopamine.
No, well, yeah, but that's not the right kind. Yeah, Wellbutrin is too, but it's not the right kind of dopamine medicine.
Gotcha.
It has to be an atypical antipsychotic type.
Okay, gotcha.
Like one of those, but yeah, we use for a lot of different things, but we use it for anxiety. We use it if they're stuck in depression. We use it for obsessiveness and stuff, but also for paranoia. So she took that, and a week later, she wasn't condescending. She was sweet. She was a better listener. I mean, these traits just disappeared, and so hers really was genetic. So that's one personality type, and then social phobia isn't really a personality type, but shy is. And some people, all of us listening right now, probably know somebody where their brothers and sisters are outgoing, but that one person is real shy. Do you have any friends like that?
Yeah, I have. And I was shy from trauma, but I was definitely not a shy kid. I was like, I just want to make everybody happy. They used to call me Boo because I would go, and this is when I was really little, my cousins called me Boo. And I was like, where did that come from? And it was because anybody that looked sad, I would walk up to them and I would put my face right up in their face, kind of like this dog that I have, and go Boo to try to make them laugh or make them mad. That was me.
That's sweet. That's really sweet.
And I'm like really that cool. Now. Sandwiched in between processing trauma, I lost that. And now that I'm in my mid-40s, that's what I'm at again.
Yeah, they call me a big teddy bear because if I see anybody hurting, I like to go give them a hug. Nowadays, you got to be careful who you hug and where you hug them and all that
true.
Sort of
Very true. Yes.
Certainly can't run for president if you do that a lot,
I have to be careful too. Anyway, I noticed with a friend of mine, a business colleague, that I'm just so used to giving him a hug and pat him on the arm or whatever. And then he looked a little uncomfortable once and he told me that he wasn't uncomfortable at all. That was just me thinking it. But I remember thinking in my head, oh, this is probably not appropriate anymore. So I've stopped. I give him a hug, but it's a very short hug, and I ask permission first, and then I don't do any other kind of, like pat on the hand or whatever, because we're just in a different age.
Yeah. But so anyway, some people are born real shy, and I'll just give you a quick case study. We can move on to the next one, but and there's different words for shy people. Introvert is another one. Schizoid doesn't mean schizophrenic. Some people think it means, borderline schizophrenic or something. Schizoid just means real shy and introverted, but maybe with a few eccentricities and things. But some people are born with social phobia, and it's from birth. And their sibs aren't that way. But all of a sudden, there's one kid from birth on, he's that way. And there was a guy that here in the Dallas area he was born that way, and he was real shy his whole life. And he was able to go to elementary school and junior high and high school, but he couldn't go to Boy Scouts. He couldn't join any clubs. He was able to go to class, but he'd keep to himself. He'd go eat by himself. He never asked a girl out on a date when he was in high school or college. And the only reason he got married is some girl proposed to him. So he ended up getting married, and he got a college degree. He was real bright. And he went into business for himself, and he ended up being the owner of a large business here in Dallas. But he would stay in the back room and not get out and mingle with his customers who came there. It was actually a large store. And he wouldn't mingle with his employees. He just stayed back in his room and sort of delegated to the one person that he could talk to, his assistant. Mm-hmm. But he heard me talking about this on the phone, about genetic
on the radio.
Personality traits. Yeah. On the radio. Yeah. He heard me talking about it on the radio. And so he got up his courage and came to see me. And sure enough, when I asked him all the questions, it was since birth. And he had kids, but he couldn't go to their soccer games, or he couldn't do, anything social. And so that's instead of a dopamine problem, that's a GABA problem. Gamma aminobutyric acid isn't working right in the brain, and we just call it GABA for short, GABA. And so I gave him a GABA medicine, and there's some that are really good, like Lamictal is a really good one, but it takes a month to work. And I wanted to really impress him and give him a little hope because he didn't have much hope. So I gave him one that works right away. And so I loaded him up on Neurontin, a large dose. I said, now you're going to be tired, but by starting right off on a large dose, but here's the dose. I want you to take it and try it out. And 4 days later, he was totally normal.
Oh my gosh.
He was able to go to his kids' soccer games. He was able to go to church. He mingled, came out and met with the customers, and came out and laughed and talked to his employees, and he was totally normal. And he would have been his whole life if he wouldn't have had a genetic problem with his GABA.
Right.
And on the medicine, he was totally normal. If he takes a GABA medicine the rest of his life, he'll stay that way. But if at age 80, he decided, well, I don't need this anymore, and he quit, he'd go right back into being an introvert again, an extreme introvert. So that's genetic. And then there's
histrionic personalities. Yes.
Yeah,
and have I experienced a lot of that.
Okay.
Not for myself, but from family members, my mother in particular. Yeah. And different people that I've been in business with. But you'd written, we have two brains, the cerebral cortex and the limbic brain. And it seems like you could throw out the limbic brain in some engineers and not notice any difference, or throw out the cerebral cortex.
Sorry for you engineers listening to it.
In some movie stars and not notice any difference. So, yeah. Oh, yeah. Yeah.
Yeah, because histrionic personalities are real emotional, and they don't use a whole lot of logic. They base their decisions and their political beliefs and everything else just on whatever emotion they're experiencing at the moment, and so histrionic personalities, a lot of them become movie stars, and they love the limelight. I've got some histrionic traits. That's probably why I butt in more than I should, because I think it's because I want to. I think maybe it's because of some of my obsessive traits, and I want everybody to know everything. But part of it might be an unconscious need to get more attention. See, so that would be a histrionic trait. But we have two brains. When you think of a brain, you think of the cerebral cortex, the gray matter on the outside. But most people don't know that there's another brain underneath it, and it's shaped just like an Oscar Mayer wiener,
right.
Shaped like a hot dog, and it goes from the front to the back, from your forehead back to the back of your head, and it's the seat of your emotions. So you have a total emotional brain and a logical brain, the cerebral cortex, with millions and millions of connections between the two. And so I think when God designed us, he wanted us to think, and he wanted us to feel, and he wanted us to, coordinate those in a healthy individual. So a healthy person can think and can feel and share their feelings, be in touch with feelings, but also use logic and not just react emotionally to, whatever happens to be, bouncing in your brain at the time. And it does seem like with some people, they're real obsessive compulsive, and and you ask them, like Dr. Spock in Star Trek, they asked him, have you ever been angry? And he scratched his chin and looked at him and says, no, I don't think I've ever experienced that emotion. And
right.
So with some people that are real Spockian, you could remove their limbic brain and there probably wouldn't be any difference in their personality because they've never used it, And there's some people, I'm being dramatic, but and there's some people that are so emotional, but and again, there's a lot of movie stars that I'm not saying they're not intelligent, but they're people that are in the limelight a lot. A lot of them are more histrionic. They're just really great at histrionics and acting and things like that.
Yes.
And they're talented, but you could remove their cerebral cortex, and you might not notice a whole lot of difference in there. And sometimes in their ability to think, or in their reactions to religion or politics, or a lot of different things that they think they know everything about.
Yeah, and someone can go
ahead.
Someone can go there too, where they're behaving more histrionic, and I had this happen with a friend who just did a show with me, and he was just going at it on social media, just picking fights with people and just saying very controversial things, and just taking, he likes to say, I like to start mini revolutions, and And, that's something that he has to control. And with him, it was that his medication was off. His depression medication was off. He was on the wrong antidepressant, and it was, exacerbating his propensity to already kind of go there, and it just made it worse. But now, different medication and all of us who love him saying, dude, this is not how you normally behave. Like, he went off on me about something, and I was like, the person that I know would never speak to me like that. Not that I feel like I'm special and should only be spoken to a certain way, but you're obviously not in your right mind. And then we just did a show yesterday, and it was wonderful because he was like, yeah, I wasn't. And thank you for saying something, Kristin, because, you knew I was going to throw some daggers at you, but you said it anyway. And that's when you know who your real friends are, the people that will say something you really don't want to hear,
Mm-hmm. So there's not any one chemical. I can't think of any one chemical or one medicine that helps people be less histrionic. It's, counseling really helps. So I don't know how much of that is inherited and how much of that's learned. In our culture in the past, men were encouraged to be obsessive compulsive by culture, and women were encouraged to be histrionic and dependent. Did you ever wonder why men's shirts button in the front and women's dresses button in the back?
No.
You never thought about that?
No.
That's
why?
a way to dominate women. It's a way to dominate women.
Oh, wow.
It makes them dependent. Somebody else has to button them up.
Oh, I never knew that.
And the
Paul.
zippers are in the back for women, and then the front for men. And
wow.
there's just a whole lot of things that are subtle, that were, women were expected to be emotional. They weren't expected to even go to college. Lots of times in a lot of cultures, and they were supposed to, be sexy and that sort of thing. And so to some extent, in the past, cultures pushed women into more histrionics and pushed men into more obsessive compulsive traits and not being in touch with feelings.
Right.
Men who are single, even today, have 300% more heart attacks, strokes, and suicides than men that are married. And I think men that are single tend to not share their feelings, and I think that's part of what kills them. And I mean, it could be, testosterone or genetics or something else. Why do women live 7 years longer than men? But women share their feelings, and so if a man is married, he's 300% better off. And I think it's because being married to a woman helps you to be able to share better. Now, in today's age, there's less difference, which is good. There's,
yes.
In that sense, there's not as much stereotyping and things like that. In that test, the test that came from was actually done about 15 or 20 years ago. So I don't know if it would be the same today, where there's that much difference for men. Women were only 2% better off if they got married. So, what do you get out of that?
Why does
it didn't
that
help
not
women much, but it was good for men, I joke around. I joke around and say, the Bible says, "He who finds a wife finds a good thing and obtains favor of the Lord." It doesn't say anywhere in the Bible, "She that finds a husband finds a good thing."
Right, exactly. She who stays single after being married enjoys a full and productive, wonderful life, doing things that she didn't do before. Yeah, exactly. Yeah. All right, so now we're on passive aggressive.
Yeah, and passive aggressive it's usually due to environment. We'll talk about that in our next podcast. But basically, passive aggressive people are people who are dependent and needy, and they let other people dominate them, and they're afraid to share anger. They feel it, or they may not feel it. They have it, but they may be aware of it, may not be, but they don't ever express it openly because they're afraid to, and instead they'll do things often without even knowing they're doing them, to express anger, passive aggressive things like I've got a friend who, he died quite a long time ago, but he was a really nice guy, but he was real passive aggressive. And when his wife would ask him to hang up Christmas lights on the house, and they had a very nice house, he went out and got 16 penny nails, those great big ones, and put them all the way around her beautiful home to hang the lights on. And then he wouldn't take them down till about February. And when she asked him if he would paint the windows upstairs, he painted them shut. And he said, well, that's to keep the hot air out and stuff like that. So he had some excuse, and he didn't do those things on purpose, but and he'd always be late everywhere. People that are passive aggressive are late everywhere, and most of those traits are we'll talk about that next week, but most of them come from having a real domineering parent that you don't dare share your feelings towards, so you learn the passive aggressive traits. And
yes, that's
but anyway, I don't want to get into that. I'm just saying some people are born though, just like some dogs are born a lot more passive, and some dogs are born just a lot more aggressive. Some dogs, if a stranger comes, they run right out to him and lick him, and other dogs run out to him and want to bite him. And there's some dogs that just cower in the corner. If anybody's near, they just cower, and without it being environmental. I mean, sometimes it's from environmental reasons, but some people are just born real more passive, and so they're more likely to become passive aggressive because they not only are shy, but they're afraid to share feelings.
Absolutely. And, I've been accused of that twice, both by men, and they were both men who have a giant history of not getting along with people. And so I was added to the list, but they are big on throwing that around. You're passive aggressive. And I'm like, no, that would be you, and you're projecting.
Yeah. Projection is a big defense mechanism. That's for those in our listening family right now, if you don't know, projection is where you've got a fault inside of yourself, but you don't see it in you. But people that you come in contact with, they might have a tiny little bit of that fault, or they might not have any, but you see a great big bunch of it in them, and you don't see any in you. And the Bible talks about that in Matthew 7:3-5. It talks about seeing the mote, or seeing the toothpick in your brother's eye when you got a log in your own eye. And paranoid people do that the most. We all do that to some extent, but paranoid people do that a lot. Because they have all that anger and their arrogance and stuff like that inside them, and they think they're really righteous, and they're the really moral one, when really the immoral one, and so they look out at other people and see other people as being evil, and that's projection. In reality, I just thought of King Solomon wrote in Proverbs chapter 6, the 7 sins. We had a program on the 7 deadly sins, but the 7 sins that God hates the most. And surprisingly, number 1 on there is a paranoid trait. It's thinking that you're more righteous than other people. So, if somebody commits a certain sin, and somebody else goes around condemning that person, criticizing that person, and things like that, in God's eyes, the person that's acting righteous in condemning the sinner is the one that's by far the worst sinner. And the one that, the woman caught in adultery, he just said, hey, learn from it, go out
and move on.
Sin no more.
Yeah.
So that's passive aggressive, and the traits are not genetic, I don't think, but some can be.
Right. And the next one is explosive personalities. Yeah. So usually from childhood abuse, but some people are born that way or have brain damage in the womb or during life, and some inherit it. They take out their explosive rage that appears out of nowhere on whoever loves them the most. Now, I dealt with this I dealt with this a lot with my ex-husband. And it was from childhood abuse. And I also learned it from his father, and maybe it was inherited. Maybe there was a genetic component to it as well, but he didn't hit me or anything like that. But the, picture NFL playing or any kind of sport, and someone who has to stand up and scream at the television about how stupid everybody, that kind of thing. And that just being the way that he was about many things, and I knew I had to learn how to, okay, well, I can't fight back and argue in the heat of the moment, because he's like a dog that finds a squirrel and chases it up a tree. Like he's just straight up into that part of his brain and doesn't hear me. So I would have to learn later to go, either you're going to not wake up in the morning because I'll have done something in your sleep if you ever do that again, or you're going to control your behavior. So it actually helped me learn how to, it actually helped me really learn how to stand up for myself, dealing with him. It was like a practice for really standing up for myself from, the things, because my father was also that way, very much that way.
And your ex really grew and
yes,
is really a nice guy now, right?
Yep. And he always has been a nice, wonderful guy, but the love them the most piece. Yeah. That piece right there.
In fact, you know what? I left off one, and this reminds me, this is a good time to put them both in together because they're separate. I mean, they're different. The sociopathic personality is somebody that has no conscience. They're evil. They're just plain evil, and they're mean just to be mean. They want to hurt you. They may act nice. That's more like borderline personalities are similar, but not quite like that. But sociopathic are just plain evil, and some people are just born more evil than others, and I don't know exactly why, but they'll explode and hurt and stuff, but they have no guilt. And whereas the explosive personality usually are really nice people, which surprises people. Explosive personalities are usually really nice most of the time, but then some dinky little thing will upset them, and they'll just way overreact and get, explosive, usually just verbally. Once in a while, they'll push their wife, if it's a guy, or if it's a woman, she may slap her husband in the face or something.
Right.
So, but they explode, but then when they explode, they feel, of 10 minutes later, they feel guilty about it. The sociopath never feels guilty.
Right.
So the explosive feels guilty and goes and apologizes, and then they'll be nice again. And some people are born explosive. Some people are real nice all their lives. I know a famous singer, real famous nationally known singer who has given her testimony about it, but I still won't mention her name. But her dad was super nice when she was growing up, and then when she was about 10 years old, her dad had a brain injury. He had some sort of accident, and his brain got injured, and the part of it that got injured made him real hostile. And so he would explode. He might be nice one minute and explode another minute. And whenever he exploded, he'd go take it out on her. And he was real close to her. She was his favorite child, but when you do explode and you don't understand, you look around and you try to figure out who am I mad at, because they know they're mad, and they think it must be somebody's fault, but really it's not, if it's genetic or caused by brain damage. And so they look around and they almost automatically take it out on whoever loves them the most. And because that's the least likely person to reject them.
Right.
And so
exactly.
I told a lady in here today, her husband is explosive and even threatened her before in serious ways, and but he's in therapy and taking meds and things, and he's not doing that anymore. But I told her, I said, I want you to know that that the fact that he always exploded on you means he really loves you. So it's a compliment. I was joking with her. I wasn't being. But she laughed. I mean, she said, "Oh, that's nice to know." I said, but he knew you wouldn't reject him, and he didn't pick you out. And I was saying this right in front of him, right in front of her. That he didn't, pick you out and say, "Okay, I think I'll get mad at her." But you just automatically that's what happens. But some people are born that way, And it could be from premature birth or an infection in the womb or things like that. But I think some people inherit a brain that's just that way.
Right.
My good friend, Dr. Daniel Amen in Newport Beach, California, does SPECT scans where he measures the brain waves in your brain. And he can tell a lot about you and what you're going through by looking at the way blood flows in your brain. And I had that done out there to see what kind of ADD I had. And being another doctor, he, as it came off the machine, instead of reading it and seeing me the next day to tell me his findings, he just pulled it off right in front of me and looked at it and said, "Oh, you're not any good at golf, are you?" And I said, "No, how can you tell?" He says, "Look at this little hole in your cerebellum. You probably had a concussion when you were a kid, and that's the part that controls your hand-eye motor coordination." And he said, "Oh, you have sleep apnea, don't you?" I said, "Yeah, how can you tell?" And he showed me holes in a certain part of my brain that come from having sleep apnea before I started using the machine. And he could tell me the story of my life by looking at my brain. But I heard him, my wife and I watched one of his podcasts recently. It's Daniel Amen, A-M-E-N.
Right.
He's
Amen
brilliant.
Clinics.
Amen Clinic.
Fantastic.
If anybody wants to see how the brain works, just go to YouTube and download some of his stuff. But we were watching one of his, and he talked about a guy that was like this, explosive in his whole life, and it showed what was wrong with his brain. And he was born that way, where that part of the brain, instead of being controlled like it's supposed to be, it would just get wired up, and it's like having a seizure. He'd explode, and lose his temper and things. And there's medications you can give that help that. Lamictal would probably help, and the atypical antipsychotics, or maybe some combination would help. But some people are born explosive. And then before we run out of time, we've got to cover our favorite one.
Obsessive compulsive. Yes.
And we'll avoid all the psychological, we'll talk about that next week. But some people are born that way. Some people, most people, I think most obsessive compulsives are probably,
I have those traits. Absolutely.
Huh?
I absolutely.
Yeah, I've got some of those traits.
Yeah.
Yeah. And people who are obsessive compulsive have a lot of wonderful traits. They're conscientious, hardworking, determined to succeed. They're competitive. They get better grades. They succeed more, but enjoy it less.
Right.
Because they have more false guilt and things like that. And firstborn, the oldest boy in each family tends to be more that way, and the oldest girl in each family tends to be that way. I'm just gonna arouse your curiosity now, and not explain why that is, so that you'll want to listen to our next podcast. But let me leave you with this teaser on that. 15 of the first 16 astronauts were firstborn sons.
Yeah.
Now that's impossible for that to be a coincidence.
Oh, absolutely.
So why would that happen? It's something like 85% of PhDs and MDs are the oldest child of their sex and their family and things like that. So there's certain things that, environmental factors, but some people are born with perfectionism. They're just born that way from birth. And I know we had 4 kids, and then we raised 2 more when their mom died. But when one of my sons is more ADD, and he's not obsessive compulsive, but he's really good at what he does now that he's grown up. But if we put balls or toys or things in his crib, he'd look at it and lick it once and throw it out.
Right.
It was too much fun to throw it out. And then one of our daughters, if you put a ball in there or a doll or something, she'd pick it up and study it for 45 minutes, looking at every little color and line and all that. And she's became a PhD. It's more obsessive compulsive, and so a lot of it you're born with. People that have obsessive compulsive disorder, that's where you got to touch things, and you got to do things in fours, and you got to do a whole bunch of different things, and you have obsessions and compulsions and stuff. People that have that disorder, if they've had it all their lives, it's genetic. If they didn't have it all their lives, but then they all of a sudden got it, usually it's due to a car accident or some other trauma, big trauma. And so they're temporarily that way. And therapy would get them over that. Therapy will not get you over genetic obsessive compulsiveness. It can help, but only medicine will get you over it. And then some people, about 1% of the population, for example, becomes schizophrenic in their 20s or 30s. And before they lose touch with reality and hear voices and have delusions, they'll become obsessive compulsive lots of times for a few months to hang on to their sanity. So but for
so it can be situational.
Genetic, yeah. So since we're talking about genetics, people that are born with it are more on the cerebral cortex side, less in touch with emotions, and they are self-critical. I explain it like if you took dog poop and put it on your glasses and walked around, looked at life and looked at yourself in the mirror, and everything would look crappier than it really is.
Right.
And people that are born obsessive compulsive have dog poop on their glasses. That other people don't look as good because they're not perfect. They expect perfection, and they don't, and they think they're worse than they are. They're very self-critical, and they're afraid to make it. They're extremely afraid to make mistakes. They're controlling, but at the same time, they're real afraid to make mistakes. So when they write a term paper in college, it'll take them forever because they'll just keep redoing the first page over and over and over again.
Right.
Because they want to get it right, And when they go to a restaurant, they're the last one to order. The histrionical personality go in there and the first whiff of something that smells good, he'll order that,
Right.
And the obsessive compulsive will look over the whole menu. And I had a patient last week that is real obsessive compulsive, and I told her, I said, I bet when you go out to eat with your family, you're the last one to order. She said, "Oh yeah, I'm not only the last one to order. Lots of times I can't even order, and I have to have my husband order for me because I'm afraid to order." And so you can be born with a lot of these traits, and it's a serotonin problem primarily. And so if I give people a double dose, if you can take any serotonin medicine, like the serotonin antidepressants, Zoloft or Prozac or Lexapro or the SNRIs work too, Cymbalta, Pristiq. You can give them any of those types of antidepressants, and if you give them double the normal dose, it'll either totally go away or go 90% away. And I wanted to end with a couple of case studies, and I won't go into great detail, but there are two that one of them I saw today, and I was going to, I pulled out and I sent you her, without using any names, some facts about her, a week ago, and it was to brag about her. And today she let me down and totally got off her meds again. They hate to take medicine.
Yes.
They feel like if you take a medicine from an authority figure like a doctor, you're losing control.
Yes.
In reality, the medicine gives you control. So here's one that I saw for the first time, and I won't tell his or her. You don't really know if it's a man or a woman, but because lots of times I'll change it and things. But anyway, let's just call it a her. But I saw this person a year ago in May, exactly a year ago, and she came to see me because she had some of the obsessive compulsive traits, and she heard that we could help. And so, and she also had some depression and some anxiety, and she had some chronic pain, and she had some ADD. But the main thing she came for help for was her obsessive compulsiveness. And she had to vacuum her house every single day. If she had to go, whenever she got a phone call and had to go somewhere, or she had an appointment to go somewhere, she could not leave the house until she dusted the ceiling fans. And there were a bunch of things that she had to do. And even though that would make her late, she could not go without doing those things. And then whenever she got a big project to do, she'd have to clean the whole house before she did that project. And I don't know if that was a way to put off doing the project or what, but it's an obsessive trait. And so she had a whole bunch of those traits, and then obsessions about, not being acceptable and unpardonable sin, and they all think, God can't possibly forgive them and all that. And so I had to really coax her, even though she came to me for treatment. I had to coax her into trying a serotonin medicine. And so finally I got her to take one, and then I saw her 3 weeks later, and I got her on Prestige. 50 milligrams is a normal dose for depression, but again, it's only half of what you need if you're OCD. And so 3 weeks later, her depression was gone, her anxiety was gone, her pain, chronic pain from her back abnormalities was almost gone, but the OCD was only about 10 or 15% better. It was a little better. And I said, well, we need to go up to 100 milligrams now, and then it'll go away. In 2 or 3 weeks, your OCD will be gone, or so minimal it won't bother you. And she wouldn't do it, and I had her keep coming back and persuading. Finally, 2 months later, she went up on the Prestige to 100 milligrams, and then she did great. She wasn't depressed, she wasn't anxious, she had no pain, and her OCD was almost totally gone. And it was so minimal that she could notice the temptation to do those things, maybe partially out of habit, but she didn't do those things anymore. And I asked her how she felt, and I'm looking at the notes right here in front of me. Oh, really good. I feel really good. And then, and so I was going to use her as a example, her or him, as an example today. But then today, I saw that person, and it just breaks my heart, because that person started getting some side effect, supposedly from the medicine. I think it was just her fear of taking the medicine, because he or she has been doing great for months now, because it's a year later. And so I said, I'm not sure that the side effect is from that, because you had that before you ever took the medicine. Those symptoms she had before she ever took the medicine. And but I said, here's 2 different things that'll get rid of that side effect. So try this. If that doesn't work, then come see me or call me again, and we'll try the second one. So she tried the first one and still had that side effect, which wasn't really a side effect, I don't think. And so without telling me, this was like almost 2 months ago, without me knowing it or anything, she just quit the Prestige and was back just like she was a year ago. The depression, the anxiety, the pain was back, the OCD was back, and she came in today and refuses to take the medicine that she knows would make it normal. And I said, well, what would you tell your best friend? I said, who is your best friend? And he or she gave me the name. And I said, what would you tell your best friend if your best friend had these symptoms and they went away for almost a year because she took something that corrected them, and now she refused to take them? And she admitted I'd tell her to take it. I said, well, then why won't you? I said, this affects your family and you and the people that you come in contact with. And she said, well, let me see if they get worse. I'll come back in a month. And if these symptoms get worse, then I promise I'll try it again. So I just got to hope she does. But see how discouraging that is? I mean, I have to be so patient with people with
Absolutely.
OCD. Yeah, and then there's one more, one like that, a guy or a gal, but somebody that always got straight A's. Let's make it a guy. Always got straight A's his whole life, but he got major dips. Lots of times they get suicidal and real depressed and things like that. And but he had panic attacks frequently all his life, and felt overwhelmed, and he had to recheck. He had to count things. Some obsessives they're always counting things. They come in my office and they'll count all the pictures on the wall or all the ceiling tiles, or they have to count all the telephone poles when they're driving down the highway. They have to recheck things, recheck the doors 4 times a night, things like that. He'd have to do things in certain numbers, like everything had to be an even number, or a 5 or a 7. And in obsessions about, again, committing the unpardonable sin or being a horrible person or different things. Self-critical, and he just had all the normal traits. When I first saw him, and that was in 2017, so that was 2 years ago. I saw him, and the first day I saw him, he was coming into the day hospital in our day program. That's where people come 7 hours a day, 5 days a week for 3 weeks. And he came in the day program, and he got daily therapy, 7 hours a day, 5 days a week to get in touch with the youngs and all that. But he was also put on meds that would correct the chemical part. And you know, if you live that way all your life, you're bound to have some psychological things to work on too. And after 3.5 weeks in the day program, he did great. He did fantastic. He was happy. He was relaxed. The OCD was gone, and he was doing fantastic. And then he left and went back to his hometown, and then about a year later, he just quit taking his medicine, and so all those things came back.
Mm.
And I wrote down in the past, he had many recurring bouts of major depression, sometimes with suicidal thoughts, in a list of methods that he considered using, gun and other ones, and often passive death wishes, most of the time wishing he could die most of his life. He had to recheck things and count things and do things in certain numbers, and very self-critical and all that sort of thing, and afraid of taking prescription medicines. But in the day program, he was willing to try it, and he took them, and he got better, and more relaxed. Loved Vyvanse for his ADD, but part of him wanted to cling to his OCD. I asked him why he quit the medicine, because I saw him again recently, and he said part of him wants to cling to his OCD. He misses it when he doesn't have it. And he said, "I know that's sick. I know that sounds crazy, but I miss it when I don't have it." And anyway, he wouldn't take the medicine, and so it's just so discouraging.
Yeah.
When you think, but
I
have a whole bunch.
Yeah.
Most of them get on it, get well,
right.
and stay well. So.
Yeah, it's very discouraging. I mean, I went through that roller coaster, with a member of my own family where, they'd get better with medication and then get very self-righteous about it, like we just talked about, and stop taking it, and then take a dive, and it's emotionally, physically, everything exhausting for the people, around that person, because it's a roller coaster constantly.
Well, a lot of
get lulled into it's going to be great because now they're taking their meds and it's wonderful, and then you go, well, what's going on with their behavior? I realize, they stopped their medication, and there you are back on that roller coaster.
Yeah, that's really sad when that happens, because if they stayed on, he was on Cymbalta, and if he would have stayed on Cymbalta the rest of his life, he would have been normal the rest of his life, and if he stayed on until he was 80 and then quit, he would become depressed and anxious and obsessive compulsive and suicidal at 80 within a month or 6 weeks after getting off it. So, if you have a genetic problem, you got to take medicine for life or it'll come back.
Right, exactly. Well, we covered a lot of ground. So tell our listeners again what we're going to talk about on the next episode.
Yeah, the next one, we're going to talk about the environmental, let me find the exact words here, podcast 2 is correcting childhood influences on our adult personality.
Right.
That's
going to be a good one.
A lot of our personality is formed by age 6, but we'll go into that later. A lot by age 3, and those early, we're going to focus on the first 6 years of life.
Okay.
And then later on, we'll talk about other things in life. But how much of our personality is dominated by the first 6 years of life. And I want to end on a positive note, though, Kristin, that whatever we inherit, whatever part of our personality we inherit, with modern medications, it's just amazing. We can correct it. You can make an OCD person, you can make an OCD person normal. by taking, a serotonin medicine. You can make a paranoid person normal by taking a dopamine medicine, and you can make a socially phobic person his whole life normal 4 days later by taking a GABA medicine. And it's miracles. It's like, being a psychiatrist is just awesome. It's so much fun because it's almost like I can do miracles, and I'm not doing them. I'm just using modern psychiatric research and giving them things that can correct the imbalances in their brain. Right. And so it's really cool. So you can heal the parts of your personality that are genetic. You can take medicine to correct. And if somebody's got personality problems and they're not genetic, then counseling is
right.
They need counseling.
Behavior modification, absolutely.
Yeah.
Well, thank you, Paul. We just did another roundtable with Dr. Paul Meier, so thanks for joining me again.
I always love it.
And thank you to our listening family for another episode of Mental Health News Radio. I know, no one likes commercials, but seriously, folks, without the help from these organizations, we could not stay on the air. Please give a shout out to zencharts.com. If you're a mental health or addiction treatment center, you'll want to use their EHR. It's gorgeous, and they're just good people. And also MyGenetics, MyGenetx.com, because knowing your genetic code empowers your mental health treatment. And lastly, CopeNotes.com. We love getting positive messages right to our phones every day from Johnny Crowder. He's the lead singer of Prison, a heavy metal band sharing their music about suicide prevention, addiction recovery, and mental health. See, that was painless. Support them as they support us. Back to the show.
Sometimes I'm passive aggressive, but never without good intentions. I heat up and act on my emotions.
Thanks so much for listening to Mental Health News Radio. Our podcast can be found on iTunes, Stitcher, and hundreds of other podcast apps, or you can visit our website at mentalhealthnewsradio.com. If you have a question or would like to be a guest, become a podcaster on our network, or join the amazing organizations that help keep us on the air, please email us at info@mhnrnetwork.com. Get ready for that special goodbye from our resident therapy dog, Miles, and a special thanks to Emily Sohn for letting us use her incredible song, Cordial, for our podcast music. Listen to the full song on SoundCloud at emily.sonne.
Don't be surprised when I don't hate on you. After all, we promised we'd be cordial. Sometimes in you I can fight it, but our opposing.
Good boy.